Hey guys, what's up? This is Larry. Are you a new nurse? Are you about to be a new nurse? I'm going to tell you some secrets that you need to know in order to become an awesome nurse. It's going to help you survive your first couple months so you don't feel defeated every day when you leave there. So stay tuned, let's get into it, and I'll show you how to become an amazing nurse. Hey guys, welcome back. So, you're about to be a nurse, or maybe you just became a nurse. Either way, you took your NCLEX, you passed. Amazing job. Now comes the real work. You thought nursing school was hard, but now you're getting ready to start your new world in nursing, and it's going to have its own struggles. So, nursing school was its own deal with studying and clinicals and care planning and so on and so forth. When you get in the real world, you're going to get a taste of some things maybe you didn't see in nursing school. Nursing in general, very rewarding job. If you care about what you do, you're going to get a lot out of it. It's going to take a little bit of time for you to get to that point and for you to feel like you leave there every day with a sense of doing something well and not defeated because you didn't do well. But let's go through these steps. These are going to help you a lot more than what you think you need when you go in, which is I need this skill and I need that skill and I need just to know how to do all the things. You're going to need to know that stuff too, but you've got to remember some important pieces that's going to help you more than anything else in your nursing career. So let's get into it. Number one, leave nursing school where it was. It had its part, it played its role, but now you're going to get into the real world of nursing. You're going to see some similarities from school, but this is not nursing school. You're going to have to learn your own workflow. You need to be really open-minded when it comes into nursing, especially depending on what you decide to do, whether it's critical care, whether it's emergency, whether it's med surg, card tele, OR. They all have their own workflows. So biggest point, come in with an open mind. Don't feel like you have this preset notion of what you need to know coming in. No, you're going to get in there and you're going to see what it is that you need to learn. So come in open-minded and be prepared to make mistakes. I think people have a really bad notion that I can't make any mistakes. I got to be perfect. Nobody's perfect. The most seasoned nurses out there on the floor, they've made plenty of mistakes. And if they tell you they haven't, they're lying to you. Everybody makes a mistake. I made plenty of mistakes coming up. I remember them well, and those are the kind of things that you're not going to do twice. You always remember, oh God, I remember when I did that this time. And, here's a good example for you. My first time I ever pushed adenosine on a patient was in the emergency room. I had heard it, never done it, but let me tell you, a room full of crowded people, and they said, oh, you're going to do it today. And I'm like, yeah, I'm going to do it. Yeah, and in my mind, I'm like, I don't know. Yeah, I'm going to try it, and I'm going to do it. And anyways, they had this really long primary line set up with a saline bag. And somebody says, I'm going to squeeze the saline bag as soon as you hook your adenosine into the low port. Adenosine's got a really short half-life, so you've got to push it and flush it in really quick. Most people do it with a stopcock, and they change it from the adenosine to a flush behind it. This is the way they had done it. I was new. I wasn't going to question anything. This may be the way everybody does it. I didn't know any different. So I have my syringe of adenosine. This lady's heart rate's ticking away, 190, 200, going to town. And I'm hooked in, I'm ready to go, and they're like, will you just tell me when you're ready and we'll count down. So I did. I said, all right, let's do it. On 3, 2, 1. I pushed that adenosine in, and I thought, there's all my glory. I did my part. I kind of froze, and I just sat there, and I'm waiting for the person to squeeze the bag. And they do. They're up on this bag, and they squeeze the saline bag, and I'm sitting there watching as if it were in slow motion. The plunger shoots out of the syringe, fluids just spraying out everywhere. And I'm like fumbling in midair trying to catch the plunger, put it back in, block the spray. People are all turning away sideways. And I look over and I see the provider sitting there, arms crossed. And she's just sitting there going. And in my head, I'm like, oh my God, I'm such a failure. Like, what did I do wrong? Like, how did I mess that up? I didn't account that the plunger was just going to shoot backwards with the pressure. Never done it before. Learning curve. Do you think I ever did that again? God, no. But truth be told, yes, I made a mistake. It wasn't the right thing. It still worked. She converted over. It was beautiful. Moral of the story is you're going to mess up, and you're going to mess up more than not as a new nurse. Be willing to accept that. That's a biggie. You have to know that you're going to make that mistake, and you got to move forward past it, and you're going to learn, and you're never going to do it again. All right, so number 2, whenever you come in, for example, if you come into critical care, you're in there day 1, day 2, still super early, you're going to see a lot of stuff. Lots of machines, lots of pumps, lots of medicines, lots of devices. You don't have to know all this stuff in a day. You can go your whole orientation and feel like, yeah, I did pretty good. You're going to get to the end of orientation and you're going to come out and say, oh crap, it's time to come out on my own. I haven't seen this, haven't seen this. Don't let that overwhelm you. You're going to have people there that can help you along the way. And some of your best learning is going to be done on the fly. I saw a lot of stuff in orientation. I was very thankful for it when I did it. But there was a lot of stuff I didn't see, or I might have seen once at the beginning and I didn't really remember. They're going to be leaders and team leads and partners beside of you. They can help you along the way. So some of your learning is going to be done on the fly. And there's just no way to learn all the stuff you need to know about nursing during an orientation phase. And the stuff you learned in nursing school more than likely isn't going to apply to what you're doing there, because it's going to be specific to certain devices or pumps. And that's okay. Take a deep breath, ask for help, and you'll make it fine. Just don't let it overwhelm you. All right, so number 3 kind of feeds off the last one. That's going to be never be scared to ask for help, or never be too proud. So we'll kind of combo that. Don't be too scared. Don't be too proud. I was too proud in my early career to ask for help when I should have. There were days when I was absolutely drowning, and I thought, if I can't do this, what good am I? Why am I doing this? If I can't do it by myself, I shouldn't be doing it, because I can't keep up. And that's just not true. I think I came with that mentality from my emergency room days of, it's you're on your own. You might get some help, you might not, so you got to fend for yourself. But that's not the case when I landed in critical care. I thought that was, but it was not. I was so many days, I was back and forth and back and forth. It's afternoon, I hadn't eaten. I just got one more task. I always say one more. And I keep bouncing back and forth, and 1 turned into 10. It never ends. So you've got to know you can ask for help. There's plenty of people willing to help you. They don't know you need the help unless you ask for it. So I learned that later on, that, it didn't matter if it was the most experienced person on the unit. There's some patients there, they're so sick that you're not going to be able to do it all. They couldn't do it all. You're not going to be able to do it all. And the only way you're going to survive is as a team. And I wish I would have learned it earlier. But once I did, it made a huge difference in my nursing career. And I was able to kind of move forward with a lot of different things. And the same goes for being too scared. As a new nurse, I think a lot of people are scared to say, I don't understand this, or can you help me with this? And that is kind of scary, because they, being a new nurse, they think, well, they're going to think I'm stupid if I don't know this, or they know it all and I don't really know this, but I don't want to look like I don't know it. And I tell you this because people don't look at you like that. People are willing and they want to help you learn. You just have to initiate that conversation and say, can you help me? And there's going to be people out there that give you a bad attitude. That's every career. That's not just nursing, or that's not this. There's always bad apples. 95% of the people that you're going to work with want to be able to help you and see you succeed. So don't be scared or don't be too proud. All right, next, I want you to find your own workflow. Go through orientation, see what people are doing, take bits and pieces from everybody's stuff, and make your own workflow. You're not going to know what your workflow is until you start branching out and you start doing your own thing. I encourage you in orientation to take that initiative and to take the reins and say, let me do all the patients after a certain time, or let me start with this one and work my way to 2 if you're in critical care, or if it's in a med tele, let me take 3 today and 4 next week. And take that initiative before you get out on your own and say, let me take the whole workload and you help me. But take all the bits and pieces that you've learned from your preceptors, take what you like and put them into your own organization. You don't have to do what Bobby Sue or Johnny did as your preceptor. You can do it in your own way, and you can take a little bit here, take a little bit there, and it makes something perfect for you. Everybody's different, so what I do is not going to be what's best for you. I can show you and I can help you, but it may not be what you need. So make your own, and as you're doing it, you're going to have to be tweaking it too, because what you take first is not always going to be the best. You're going to say, I don't really like that. So take it, twist it, turn it, whatever you need to do, you're going to find it eventually, and you're going to say, this works really good for me. So individualize your own workflow to optimize your day. All right, so something simple. This is as you run into stuff that you've never seen before, disease processes you've never seen, treatments that you've never seen before. Take it, jot it down if you don't have time right then, but I want you to sit down and do a little bit of homework for yourself. I want you to learn about those things that you haven't seen before. That way, next time you see them, you'll be prepared for what's to come. So if you don't know about the disease process, read up on it. Go home the next day, whenever, read up on that disease process. That way you have a better understanding. Or if it's a new device that you're learning, look up that device or ask for any educational pieces that they may have on the unit about that device. Take that with you, learn. That way, next time when you come, you may not understand it 100%. That's okay, but at least you've got a little more knowledge this time than you had last time. You'll be better prepared when you hit the floor. And trust me, you don't want to be the person that's not prepared or you don't know about something like that. Because it's embarrassing when somebody says, hey, tell me about why this is going on with this patient. And you say, you're kind of fumbling through it. That's not the position you want to be in. Brush up, do the homework, be able to answer those questions. If you can't answer the whole thing, that's okay. But at least if you can speak to it, you're going to feel better about yourself as a nurse. And that's also going to help you with your assessments and knowing what to look for. So a big one for me is getting to know your families and understanding the people that you meet in your nursing career generally are going to be in the worst positions of their lives. Usually their loved ones, their moms, their dads, their wives, kids, whoever it may be. Those people are in the worst shape of their lives sometimes. And working in critical care, I see that more so than not, because I meet a lot of people when their families are in a position where they may not survive hours, minutes, days. We don't know sometimes, and there's no guarantee on these things. So getting to know the families and being a support system for them and truly kind of understanding what they're going through at that time. Sometimes you think that doing the nursing task is what's needed, but sometimes it's that step further, that it's just sitting and talking with that husband or wife or mom about their loved one to them is really what they need the most. And then when you get the opportunity to discuss these things with the patients and the families together, when things are looking better, like that's a strong bond that I just can't tell you what that means to people. So don't just focus solely on tasks. Put yourself out there, open up to these families and patients, and the reward that you're going to gain from that is going to be so much further than what you ever thought when you talked about it in nursing school, about doing nursing as a career. You're going to get to know families, and there are many families that I've grown close to over time, and I personally feel this huge reward. Sometimes the ending is not always what we want it to, but you can also have something beautiful there too with the family and being able to support them through the hardest times as well. So please don't forget about getting to know your families and your patients and being able to take care of them in those ways too. All right, finally, this one seems like a no-brainer, but I promise you, with all the other things that go on and the stress of the job, is treating people with kindness. And I'm not just talking about your patients or the patients' families. In nursing, you have tons of ancillary services. You've got respiratory, you've got housekeeping, you've got physical therapy, you've got food nutrition. They just keeps going on and on and on. And if you're working in an acute care setting where there's a lot of different services, be kind to all those people, because that's just it's just a very common sense thing, but it's going to make life so much easier for you as you make those connections and people see you and they're like, oh, every time she speaks to me, and this is, this could be the housekeeper. You give her the time of day, and you speak and you ask how they're doing. Like, you don't know how much of a difference that makes. And you see so many people and you reach so many people. You need to get out there, treat everybody that you come into with kindness. These are going to be people that you may need down the road someday, and they're going to remember, oh, they're always so nice to me. I'm going to do whatever I can do to help them too. And it may be in a time where you need somebody to help you, or maybe you are not having the best day and they see you and they know you're always in this kind mood, and they see you and they pick you up by speaking to you. And this is just what we need to be doing in general. Like, this is an everyday thing for everybody you come in contact with. Yes, I know people have bad days, and that's cool. That's fine. But in general, let's just treat everybody with kindness. It's going to get you so much further in life. And so I hope all these different things are going to help you along your way, and it's going to make your nursing career better and easier if you can kind of go by those things and make sure you're doing those every day. There's no magic pill that says, hey, I'm going to do each one of these things and I'm going to be a great nurse. No, it's not going to make you a great nurse. Time's going to make you great. You doing those things are going to make you great. And just doing the right things for people are going to be what you need to do. It's not going to come overnight, though. No magic pill, no magic formula. You got to put your time in. You got to do the work, and things will get better and better and better, and you'll see what I'm talking about. So don't let the first 6 months of your career define you down the road. It's going to take a lot of time. So if you feel nervous and you feel anxious after coming in for 6 months, 7 months, 8 months, and you still have that anxious feeling, it's perfectly normal. I did that for probably a year, and it's just the way it is. Accept that and grow with it, and you'll become an amazing nurse. I have no doubt about it. So I'm going to break it off there. I appreciate you guys coming and listening to me today. We'll start working on some more content coming up, so stay tuned, and I'll see you guys soon.